guys, welcome to my channel Speak Your Mind, and I'm Nisha, and today we'll talk about depression, the symptoms of depression, the causes and the reasons of depression, the diagnosis and the treatment for depression. So let's begin the video. What is depression? Depression is serious mental condition which won't go away because you just want it to. Depression is a mood disorder that causes a persistent feeling of sadness, loss of interest, interferes with one's ability to do work, laugh, or day-to-day tasks or daily tasks. Feeling depressed or clinical depression are two different things. We can get sad, lonely, lacking of energy, argument with someone, even changes in weather can affect our mood. Changes in weather can bring sadness in our life, and circumstances changes and those feelings of sadness just disappear. But people with depression experience these feelings more intensely and for longer. People with depression find it really difficult to do regular tasks or daily tasks. Depression is very common and anyone can feel depression at any point of time or experience any time. Clinical depression affects how you feel, how you think, how you behave. You may also face challenges to do daily activities like your work, household duties, some other activities which you normally enjoy to do. And sometimes it feels like life is not worth living or life is just worthless. Depression can be difficult to describe or understand because it is invisible. It is a disorder defined by feelings rather than actions other than obvious reasons of your physical problems like fever, headache, flu, and other physical issues. Depression is very real health condition and is becoming increasingly common in general population. Approximately 1 in 4 people experience depression sometime in their life. Depression is an illness, medical condition. It can happen to anyone. It is more than just feeling low or sad during tough times. To understand what depression really is, we need to discuss about symptoms of depression. Depression has symptoms related to how someone feels and thinks. Symptoms include constant feeling of anger, sadness, helplessness, lack of energy, feeling tired all the time, loss of appetite, hopeless, sleep problem, lack of confidence, thoughts of suicide or suicidal thoughts. Symptoms related to feelings: sad or teary, lack of energy, anger, guilt, constant feeling of sadness, feeling tired all the time. Symptoms related to negative thoughts: life is not worth, I am not good as a person, it's all my fault, I am responsible for everything, people would be better off without me, life is not worth living, or life is worthless. Symptoms related to behavior: not involved in social activities, staying in or always locked inside the doors, less productive at school, college, or at work, drinking more alcohol or drug abuse. Physical symptoms: sleeping problem, lack of appetite, weight loss or weight gain for no reasons, feeling down or sick, headache, muscle pain, joint pain, fever, flu. Depression can have lots of different symptoms and every person experiences different symptoms of depression. Low mood, loss of interest in things or hobbies you normally like to do or enjoy, poor concentration, low productivity, lack of confidence, restlessness or slowness, recurring thoughts of suicide. According to psychiatric guidelines, if you have at least 5 of these symptoms, you can have depression. Symptoms can come and go over a period of months or years. What's in our head is not imaginary at all. It is very real. Our thoughts, behavior, feelings are influenced by complex series of chemicals in our brain, which can impact anyone or disbalance brain cells anytime. Exact cause or reason behind depression is still unknown, but there are some common causes like genetic factors. Genetics play an important role in depression. People who have a family history of depression are more likely to experience depression. But it is not necessary the person who has a family history of depression can have depression. Environmental factor also plays an important role in depression. Experience traumatic event or stressful childhood or some other stressful situation may trigger this disorder. Physical health also plays an important role in depression. If person already have some serious health issues like diabetes, thyroid, and can say cancer, then the person has higher chances to experience depression or having depression. How is depression diagnosed? A mental health assessment usually involve a discussion or answering questions as well as physical examination. Your doctor will want to understand how you feel, think, or behave, how you talk to other people, how you react with different situations, as well as physical examination. Your answer will help your doctor with diagnosis, and your answer will help your doctor which treatment will be best for you, like medicines, lifestyle changes, or therapies will help you or not. When to see a doctor and when to visit a doctor. If you are feeling sad, lonely, overwhelmed most of the time, if the feeling of symptoms have been with you for 2 weeks or for more than 2 weeks, if your low mood affects your daily activities or your daily routine, the sooner your symptoms are addressed, the better the outcome and the treatment will likely be. Some people with depression feels like life is not worth living or they feel themselves are worthless. If you are experiencing suicidal thoughts, don't wait. Seek for help. Seek help now or call your doctor immediately. What are the possible treatment for depression? There are different type of therapies like cognitive behavioral therapies, psychotherapies, where doctor will communicate with you and work on your thinking and the way you react in the situations. And if you have some serious depression or you are going through very serious phase, then of course you can go for medicines like antidepressant and antipsychiatric medicines. And exercise and lifestyle changes. Exercise is really important in depression. So sometimes if you are on your first phase of depression, doctor might suggest you to do exercise or lifestyle changes like good food, healthy lifestyle, walking, yoga, and meditation. In depression, lifestyle changes impact a person's life a lot. Sometimes patient needs medicine as well as therapy for depression. It totally depends on person's condition and how worst is the situation. If you know someone is struggling with depression, encourage them gently to seek out for help. Sometimes person with depression feels guilty or ashamed or feels shy to ask for help. Then gently explain them that depression is a medical condition and it won't go away without any help. And tell that person that it is not a weakness or personality trait and they should not expect themselves to get over it without any help. Open conversation about depression can break the stigma and make it easier for people to ask for help. And the more patients seek, the better treatment. In summary, depression is a disorder that is widespread but poorly understood or misunderstood. The symptoms of depression negatively impact the person's thoughts, feelings, and emotions. However, the treatment can help to treat and manage the depression. So, if you or anyone you know is facing depression or having symptoms of depression, make sure you seek out for help and understand that depression is very real. It's not a myth and it's not a taboo. It's a really serious mental disorder or mental illness. And anyone can experience depression in their lifetime. So this is it for today and I'll see you in my next video. Till then, take care. And before going, just make sure you like, share and subscribe my channel. And don't forget to press the bell icon button